When a resident with Alzheimer's disease becomes agitated, the best response by the CNA is to A. Restrain the resident to prevent injury. B. Speak calmly and redirect their attention. C. Argue and correct their confusion. D. Leave the resident alone until they calm down. Answer B. Speaking calmly and redirecting attention is an effective de-escalation technique. It helps reduce agitation and avoids confrontation, which can worsen confusion or distress in dementia patients. The correct method for removing a soiled gown from an isolation room is to A. Pull it off over the head quickly. B. Roll it from the inside out and avoid touching the outside. C. Remove gloves first and then untie the gown. D. Ask another aide to remove it for you. Answer B. Soiled gowns should be removed by rolling them inside out to prevent contamination. Gloves should be removed before the gown, and care must be taken not to touch the outer surface. If a resident refuses a bath, the CNA should A. Report it as non-compliance. B. Force the bath, as hygiene is essential. C. Respect the decision and try again later. D. Skip bathing indefinitely. Answer C. Residents have the right to refuse care. The CNA should respect their wishes but make efforts to revisit the task later, explain the benefits, and encourage cooperation. Which of the following is an early sign of pressure injury? A. Open wound with drainage. B. Black necrotic tissue. C. Red or purple area that does not blanch. D. Pus formation. Answer C. Non-blanching redness or purple discoloration is an early indicator of pressure injury. Identifying it early is crucial for prevention and treatment. When transferring a resident from bed to wheelchair, the CNA should A. Pull the resident under the arms. B. Use a gait belt and stand on the resident's weak side. C. Let the resident stand on their own. D. Place the wheelchair on the resident's dominant side. Answer B. A gait belt ensures safe transfer, and standing on the weaker side provides support. The wheelchair should be positioned on the resident's strong side to facilitate movement. A CNA observes a coworker hitting a resident. The first action should be to A. Confront the coworker. B. Document the incident later. C. Report it immediately to the nurse. D. Ignore it, assuming it's a one-time mistake. Answer C. Abuse must be reported immediately to protect the resident and comply with legal and ethical standards. Delaying or ignoring abuse is also considered negligence. When caring for a resident with a hearing aid, the CNA should avoid A. Removing the battery at night. B. Speaking clearly and facing the resident. C. Using water to clean the hearing aid. D. Storing it in a safe, dry place. Answer C. Hearing aids should never be cleaned with water, as moisture can damage the internal components. Use a dry cloth or special cleaning tools. When feeding a resident who has had a stroke, the CNA should A. Feed from the unaffected side of the mouth. B. Offer large bites to prevent choking. C. Feed quickly before the food cools. D. Lay the resident flat after eating. Answer A. After a stroke, residents may have facial weakness. Feeding on the unaffected side prevents aspiration. They should remain upright during and after meals. The most important step in hand washing is A. Drying hands with paper towels. B. Rinsing with warm water. C. Creating friction by rubbing hands together. D. Applying soap quickly. Answer C. Friction removes microbes from the skin. Proper hand washing with friction is essential to prevent infection transmission. A resident's care plan includes NPO status. The CNA should A. Offer small sips of water. B. Allow the resident to chew gum. C. Not give anything by mouth. D. Feed only thickened liquids. Answer: C. NPO means nothing by mouth. Giving anything orally, including water or gum, could violate medical orders and cause harm, especially before surgery or testing. Which is an example of neglect? A. Failing to answer a call light for 40 minutes. B. Not documenting a minor skin tear. C. Reporting a coworker's mistake. D. Assisting a resident with meals. Answer: A. Ignoring a call light for an extended period is neglect, as it may lead to physical or emotional harm by ignoring basic needs. What is the correct action if a resident begins to fall while walking with a CNA? A. Try to hold them up completely. B. Step back quickly and yell for help. C. Ease them to the floor and protect their head. D. Let them fall and then call for help. Answer: C. Safely guiding the resident to the floor while protecting their head minimizes injury. Never try to fully support a falling person, as it can cause injury to both parties. A CNA finds a resident unresponsive but breathing. What should the CNA do first? A. Leave to call the family. B. Begin CPR immediately. C. Stay with the resident and alert the nurse. D. Administer oxygen. Answer: C. The CNA should stay with the resident and call the nurse. Since the resident is breathing, CPR is not needed at this time. Which of the following is a correct use of a restraint? A. To prevent the resident from wandering. B. Only with a doctor's order and as a last resort. C. For CNA convenience. D. When the resident becomes verbally abusive. Answer: B. Restraints can only be used with a physician's order and must be the last option after trying less restrictive measures. The CNA notices a resident has a new skin tear. The best first action is to A. Apply lotion. B. Cover it with tissue. C. Notify the nurse immediately. D. Ignore it if the resident isn't in pain. Answer: C. Any change in skin condition must be reported. Prompt care prevents infection and worsening of the injury. The purpose of using a draw sheet when moving a patient is to A. Avoid having to lift the patient. B. Prevent friction and shearing injuries. C. Help the patient practice self-care. D. Replace a soiled bed sheet. Answer: B. A draw sheet helps prevent skin breakdown from friction and shearing during repositioning. It also helps ensure safe body mechanics for staff. Which of the following would be considered a sign of dehydration in a resident? A. Moist mucous membranes. B. Increased skin elasticity. C. Dark, concentrated urine. D. Frequent urination. Answer: C. Dark urine is a classic sign of dehydration, indicating the body is conserving water. Other symptoms include dry mouth, confusion, and dizziness. What is the best way to prevent the spread of infection in a healthcare setting? A. Wearing gloves for all tasks. B. Isolating all residents. C. Proper and frequent hand hygiene. D. Wearing masks at all times. Answer: C. Hand hygiene is the most effective way to prevent the spread of infection. Gloves and masks are useful in specific scenarios, but hand washing is essential for all. A resident complains of chest pain and shortness of breath. The CNA should A. Give the resident aspirin. B. Help the resident back to bed and wait. C. Call the nurse immediately. D. Ask another resident for help. Answer: C. These are potential signs of a heart attack. Immediate notification of the nurse can save the resident's life. CNAs must not administer medications unless directed. A resident tells the CNA, "I want to die." What should the CNA do first? A. Say, "Don't talk like that." B. Notify the nurse immediately. C. Ignore the statement. D. Encourage the resident to take a nap. Answer: B. Statements indicating suicidal ideation or depression must be taken seriously and reported to the nurse promptly for appropriate mental health intervention. Which action by the CNA best supports a resident's independence during bathing? A. Finishing the task quickly for the resident. B. Allowing the resident to perform as much as possible. C. Washing the entire body regardless of the resident's input. D. Encouraging the resident to skip bathing if tired. Answer: B. Promoting independence helps maintain dignity and functional ability. The CNA should assist only as needed. What is the proper method for cleaning a resident's dentures? A. Soak them in boiling water. B. Use a toothbrush and toothpaste designed for natural teeth. C. Brush them over a towel or sink filled with water. D. Scrub them with alcohol wipes. Answer: C. Dentures should be cleaned over a towel or water to prevent breakage if dropped. A denture brush and mild cleanser should be used, not regular toothpaste. A resident begins to have a seizure. The CNA should: A. Place a tongue depressor in the resident's mouth. B. Hold the resident down. C. Move objects away and protect the head. D. Leave the room to call for help. Answer: C. During a seizure, never restrain or insert objects into the mouth. Protect the resident from injury and stay with them until the seizure ends. Which of the following is a sign of hypoglycemia? A. Flushed face and thirst. B. Shaking and confusion. C. Slow pulse and deep breathing. D. High fever. Answer: B. Hypoglycemia, low blood sugar, may cause trembling, sweating, confusion, and dizziness. Immediate intervention is crucial. The CNA is assigned to perform passive range of motion (ROM) exercises. This means: A. The resident moves the limbs with assistance. B. The resident moves independently. C. The CNA moves the limbs without resident help. D. The doctor performs the exercise. Answer: C. Passive ROM is performed by the caregiver when the resident is unable to move the limbs themselves. It maintains joint flexibility and circulation. When providing perineal care to a female resident, the CNA should wipe: A. From anus to urethra. B. Side to side. C. From front to back. D. In circular motions. Answer: C. Wiping from front to back prevents the spread of bacteria from the rectal area to the urethra, reducing the risk of urinary tract infections. Which of the following is the most accurate method of measuring body temperature? A. Axillary. B. Tympanic. C. Oral. D. Rectal. Answer: D. Rectal temperatures provide the most accurate core reading, though it may be uncomfortable and is used only when necessary. A resident with dysphagia requires: A. A high-sugar diet. B. Thickened liquids and soft foods. C. Fasting before all meals. D. A high-fat diet. Answer: B. Dysphagia means difficulty swallowing. Thickened liquids and soft foods help prevent aspiration and choking. The CNA hears a resident calling for help but is busy with another resident. The best response is to A. Finish the current task, then check later. B. Tell another CNA to ignore it. C. Quickly ensure the first resident is safe and check the one calling. D. Assume the call is not urgent. Answer: C. All calls for help must be addressed. Ensure current safety, excuse yourself, and attend to the resident in need. When measuring a resident's pulse, the CNA should count for 60 seconds if A. The pulse is regular and strong. B. The pulse is irregular. C. The resident is resting. D. The resident is asleep. Answer: B. Irregular pulses require a full 60-second count to ensure accuracy, as skipping beats or irregular patterns may otherwise go unnoticed. The correct term for difficulty breathing is A. Apnea. B. Dyspnea. C. Cyanosis. D. Tachypnea. Answer: B. Dyspnea refers to labored or difficult breathing. Other terms include apnea, no breathing, cyanosis, bluish skin, and tachypnea, rapid breathing. Which of the following would be considered an example of physical abuse? A. Calling the resident a bad name. B. Refusing to give a resident food. C. Slapping or hitting a resident. D. Ignoring a resident's needs. Answer: C. Physical abuse involves inflicting bodily harm. Any form of hitting or slapping is a serious offense and must be reported immediately. Which of the following statements is true about resident rights? A. Residents give up all rights when they enter a facility. B. Residents have the right to refuse care. C. Only family can make decisions. D. Residents cannot access their medical records. Answer: B. Residents always retain the right to refuse treatment, be involved in their care, and have access to their records, regardless of their living situation. Before assisting a resident into a shower, the CNA should first A. Check the water temperature. B. Undress the resident immediately. C. Pour shampoo into the water. D. Lock the door. Answer: A. To prevent burns, always check the water temperature before placing a resident into a tub or shower. This is part of standard safety protocol. Which of the following would help prevent contractures in an immobile resident? A. Frequent bed rest. B. Proper body alignment. C. Active or passive ROM exercises. D. Extra blankets. Answer: C. Contractures are permanent tightening of muscles. Regular range of motion exercises prevent this by maintaining joint flexibility and muscle function.